Your hormones affect your tendons, your ligaments, and let's talk about it. We've known since 1996 that estrogen and progesterone affect women and their connective tissue. And in this particular article, that is one of the landmark articles from 1996, is talking about the ACL. Now, we know that females are more at risk to tear their ACL. Oftentimes we talk about the wide Q angle, which means the width of the pelvis compared to the knees, making a wide Q angle means that we have more rotary instability in our knees and we're more likely to tear our ACL. Now, when you have issues such as tendonitis, it's not just that you don't have enough estrogen or you don't have enough progesterone. Is that estrogen binding to the receptors? Because it's not enough to just have the estrogen. Does it bind? So in this article from 96, it says it's been documented that female athletes have a higher prevalence of ACL injuries more than male athletes. We've always talked about it being the Q angle. Men have a higher, wider pelvis. Although the etiology of this remains unknown, possible explanations include gender-related differences in physiological and physical factors. So cellular versus mechanical, hormones, ligament size, coordination, training, strength, endurance, anatomy, and muscle fiber composition. Newsflash, all these matter. An area that has received little study is the role of hormonal differences in predisposing female athletes to injury at the ACL. This was in 1996. And now here we are, and you're just learning that your hormones affect your connective tissue, such as tendons and ligaments. So these hormones have been shown to affect the composition of the structure of a variety of tissues. Estrogen has a widespread effect on the growth and development of bone, muscle, and connective tissue. Sex hormones have been shown to have an influence on collagen, elastin metabolism, in the rat's uterus, joint capsule, periodontal tissue, skin, fascia, the aorta, and tail tendon. Okay, I don't have a tail tendon. But we can't exactly compare perfectly rats to us, but it's a start. So estrogen increases the concentration of the relaxin receptor in the rat's myometrium, thereby enhancing its sensitivity to relaxin. Okay, relaxin is the hormone that makes things loose when you are pregnant, and actually it has a role even when you're not pregnant. So relaxin is a relaxing, think of it as loose. So subsequent exposure to relaxin may cause laxity. Okay, so relaxin causes laxity. You can remember that. Progesterone also affects the structure of musculoskeletal tissues and has been demonstrated to increase collagen concentration in the hip joint capsule. Do you know where women have a lot of problems? Hips. Therefore, it is very plausible that sex hormones, especially during periods of local fluctuations in concentrations, may influence the structure and composition of the anterior cruciate ligament as they do in other tissues. And here's a picture from the article showing the estrogen receptor. Here it is if you want to look closely. Here's the estrogen receptor in a paraffin embedded section of the ACL, the human ACL. And this was the first study in English literature that they know that demonstrates estrogen and progesterone's receptors. It was 1996. This was when I was a sophomore in high school. They finally learned that hormones did affect female athletes and their ligaments, tendons. Isn't it amazing? So the localization of estrogen and progesterone receptors suggests that the female steroid hormones may have an effect directly or indirectly on the structure of the ACL by means of targeted cells like the cells in the synovium, fibroblasts, cells in the blood vessel walls. Several mechanisms are possible by which local concentrations of estrogen may be related to weakening of the ACL. Therefore, it's possible that steroid hormones directly affect the metabolism of cells in the blood vessel wall. Thus, changes in the estrogen concentration may result in a modification in the blood supply of the ACL. And their study suggests that the female sex hormones, along with other etiologies, may contribute to the increased prevalence of ACL injury in female athletes. And this study identifies the respective cell types in the human ACL that are positive for estrogen and progesterone receptors, which are required for ligand action. There are receptors for your sex hormones in your connective tissue. And this is why when your hormones change, you are more prone for tendonitis. You have changes in the tendon, in the synovium, in the blood vessels, even nerves. Hormones matter.